everyone. My name is Jenny Barbanel, and I'm a cardiologist here at the Heart Center at St. Louis Children's Hospital. At the recent Dose of Magic event, we discussed the topics of advocating for your child and navigating throughout school, two things that I have personal experience with and am very passionate about. I'm honored to be joined by my two experts, Dr. Suzanne Pearson and Miss Elizabeth Fox. Elizabeth is the program coordinator for the local organization Impact, and Dr. Pearson is a neuropsychologist here at Children's. Thank you for being with us today.
Thank you.
We'd also like to thank the Ollie Hinkle Heart Foundation for their partnership and their continuing education series. Thank you for your work in our heart and lung community. One last note before we begin, we'll be giving away fabulous prizes to the first two people who submit questions during this discussion. That's right, all you have to do is give us a question and be one of the first two viewers to do this, and you can get one of the following prizes: a Guardian of Childhood pin, a fabulous Heart Center t-shirt, an Ollie Hinkle Heart Foundation travel coffee mug, blankets, and shirts. So, to begin, Dr. Pearson, can you tell us a little bit about yourself and what does a neuropsychologist do?
Sure. I am a pediatric neuropsychologist at St. Louis Children's, like you said. A lot of times people aren't sure exactly what a neuropsychologist is, but a neuropsychologist is a psychologist, typically a clinical psychologist, so a doctorate in understanding brain-behavior relationships. But a neuropsychologist is required to have additional training in understanding how different medical conditions can impact brain development. And so with that, we tend to conceptualize things from a medical perspective and oftentimes work within the hospital systems to evaluate kids.
So sometimes our heart kids can have troubles at school, and it might be related to some things that are going on with their brain and their hearts. What kind of things do they have at school? What kind of problems do they see?
Sure. There's actually quite a bit of developing literature as far as some of the difficulties that can be evident. One of the interesting pieces is that typically kids with a history of heart defect actually don't have an intellectual deficiency. So a lot of times if there are struggles at school or at home, it's not due to a lack of intelligence. So most of the time we aren't seeing kids who have a history of an intellectual disability or what used to be called mental retardation. Typically the issues are more related to a couple different things. One is attention, and oftentimes there can be issues with what's called executive functions. So things like planning, problem solving, how well a child can organize information, working memory, so how well can they keep in mind a couple things. So, you know, if you were to give your child a couple tasks, unload the dishwasher, make your bed, they wouldn't intentionally not follow through with those things, but they may not be able to keep those things in mind. The literature also indicates that there can be some difficulties with fine motor skills. So how well can they keep up with writing demands? How well can they accurately use their hands? Is handwriting an issue? We can also see some difficulties with visual spatial skills. So how well can they kind of literally see where things are at in space? And kind of line things up if they're having to copy a calculation problem or something like that. There can also be some difficulties with higher order language skills like social communication. How well can they kind of pick up on nonverbal cues? So do they use facial expressions appropriately, gestures? And when those kinds of difficulties are present, we can also see some struggles with peers. And there can also be some difficulties as far as how well kids can keep themselves even keeled as far as regulating their behavior and regulating their mood as well.
So just a follow-up question. Does that mean there might be more incidents of ADHD in these kids?
Absolutely. So that tends to be kind of a primary concern. So a lot of times when I see a kiddo with a history of heart defect, that's something that's on the table as a possible concern.
So Elizabeth, as a parent of somebody who as a parent and as well as your part in Impact, what kind of things would you tell parents to do if they thought a kid was having problems?
So the first thing I would do is recommend that the parent communicate with the teacher. They can say something first, but I would always put the concerns in writing. And if they do want an evaluation for a 504 plan or an IEP, which is an individualized educational plan, I would also put that request in writing. and state in that request what diagnosis the child has, when they received it, and what exactly their concerns are.
So back to you, Dr. Pearson. So if a family thought that their kid was having troubles, they can go to the school, as Elizabeth was telling us. What other options do they have available to them to get help?
So one of the things that families can do is definitely talk to their child's medical team. So they might start with the pediatrician, but certainly if they're aware of this concern from a heart perspective that there could be impact due to that history, certainly talking to their cardiologist would be a good first step as well.
And Elizabeth, what's one piece of advice you would give families when dealing with the school system, and what's the biggest piece of advice you'd give them?
The biggest piece of advice I would give is that you know your child the best. You are your child's best advocate, and in most cases, you're your child's only advocate. So if you have a feeling that something isn't quite right, I would go ahead and follow through on that feeling.
Dr. Pearson, do you have anything to add?
I think that one of the struggles is that, really the literature is just starting to emerge as far as some of the cognitive concerns. And we're starting to certainly start to assume survival in these kids, but now we also want to make sure that quality of life is also emphasized. And as medical professionals, we're just starting to kind of learn what's out there, but a lot of times in the schools, they may not have had a single kid in that school who has had a history of a heart defect. So they're really starting at square one and kind of understanding what that child's needs are. So as you said, a parent is really, they're the most knowledgeable about their child and helping to kind of figure out, we know some of the difficulties that are there. Now what are some of the resources that we can do to really support some of those areas of concern?
And I'm glad you brought that up. We're working here at Children's Hospital to sort of get a program up and running so we can help these families with exactly the issues that we were talking about today. And one of the things that I would just add is as a parent who has a kid who's needed special services, you really are the only advocate that they have. You are their advocate. So it looks like we have a question. So from Tiffany Palmer, how do I make sure my child's classmates are up to date with vaccinations? I'll take that question. So the bigger issue is that most kids, matter of fact, in all public schools, they have to have a physical form that's signed off by their pediatrician. And usually that they have to provide a statement of vaccines. There is really no way for the school to tell you if a kid is not vaccinated, because the family can sign a release saying that they choose not to vaccinate their children. But that being said, most kids are vaccinated, so there is a probability that that shouldn't be a problem. Looks like we have another question from Salvador Ruiz Espinoza. What should we be more careful with since he is going to school? Do you guys have a thought on that? I think the question, what the question's sort of getting at is, do we need to worry about our kid who has heart disease going to the school? And as a pediatric cardiologist, my answer would be most of our kids are pretty normal, and that they don't really have too many limitations. And as long as you're in contact with the school and discuss openly with the school what issues that your kid has, I think it's safe to send your kid to school. But I think it's good to be open with the school, and maybe Elizabeth, you can comment a little bit about that as well.
Yeah, I would agree with that. I think having good communication with the teachers and administrators is very important, and sharing your concerns with them is always important as well.
And yay to our first two question people. They get a prize. Question from Daniel Palmer. Do you help the parents navigate the local aspect for their children with these difficulties? Social aspects. That's a very, very good question. And that's one of the things that we're trying to work on with our program here at Children's Hospital, is trying to develop a program where we can help you in the school system, but that's where Impact can help you more. And so maybe, Elizabeth, you can add to that question.
I think, again, as a parent, and I don't want to overstate this, but I think it's important to reiterate, you're the child's advocate, so that's the first thing. It's hard sometimes to see your child go to school. You have a lot of concerns, but you just have to remember that schools have been doing this for a very long time. They're there to help you, and they are there to be your partner.
And does Impact go into the schools if you need help?
Yes, we will attend meetings with parents. We will also help them over the phone where they can call in, and we can give them action plans. And then if they do have a meeting, we can go with them.
And what's the best way to get in contact with you guys?
The best way to get in contact with us is our website, which is www.missouriparents, and that's plural, act.org. You can submit questions online, and you can also call our 800 number, which is there as well.
Okay, perfect. Yeah. That's an excellent resource. Another question from Danny Menzer. So you think there is a link between the two, congenital heart defect and psychology? Would you like to elaborate on that, Dr. Pearson?
Sure, absolutely. There, like I said, there's a lot of emerging literature indicating those two. One thing that I didn't mention is that when we think about emotional and behavioral functioning, actually the same part of the brain that's in charge of helping to make sure we pay attention to what we need to pay attention to and really kind of help us make good decisions is also in charge of helping to keep us even keeled with our mood and our behavior. So there is definitely a brain link. We also know environmental influences as well can contribute to some difficulties. So if we don't have if we don't know kind of what to expect as far as is this an appropriate thing to expect for our child to be able to do, and we tend to think, well, maybe they can't handle that, so we'll do that for them. Then there can be some difficulties whenever that child really is challenged, in a different setting where they do have to kind of problem solve on their own. So, neuropsychologists can be involved, but then there's also pediatric psychologists if there are difficulties with kind of keeping your mood in check or your behaviors in check. So we might also want to think about some therapy as well.
Okay. And I would just comment to that a little bit. The literature has suggested that the way that the blood goes through the fetal brain in kids that have a heart defect is actually somewhat different, and they've done fetal MRIs, and the brains have been different in kids that have congenital heart disease versus fetuses that don't have congenital heart disease. There's also some thought processes that when we do heart surgery, that this can also contribute to some of the issues that we see. But interestingly enough, we're finding that there's more of a link between the two than we used to think that there was. So to the next question, I'm going to hopefully say the last name right. Liz Tabaka. How soon is 3D printing using actual cells going to be a reality? That's a great question. So we are using some 3D printing to help with some of our modeling of what's going on in the heart. And in particular, we're using the 3D printing for surgical planning, which is very interesting. But as far as 3D printing with the actual cells, we are not that far yet. There's been some experimental stuff looking at using 3D cells for building different structures within the heart, but I think that this is really on the distant horizon. I don't think that it's going to happen in the next 10 years, maybe in the next 20 years, but I could be wrong, but it's very fascinating stuff.
Another one, we didn't get a chance to write it down because it just came through. Do you see a pattern of bad eating habits in children with CHD?
So to repeat the question, do you see a bad eating habits in kids that have congenital heart disease? Okay. So I'll answer that one. I think that we don't really necessarily see bad eating habits. I think that sometimes families' understanding is that their kid can't do any physical activity, and sometimes myself as a parent, sometimes I will appease my children with junk food, and I think that sometimes there's a component of that goes on as well. And honestly, genetics, if a family has issues with genetics, as far as obesity within the family and some of the personal choices within a family can also affect kids with congenital heart disease.
This tag on to the question
So that's a very good question. We actually do see that in our kids, and that's probably related to some of the issues going on in the brain. And Dr. Pearson, can you comment a little bit about that? Oh, I'm sorry. So the question was, the follow-up question is that the person who sent in the question, their son has problems eating certain foods because of the textures.
Sure, certainly can be a difficulty that we tend to see. That's not something that a psychologist would typically treat, but it might be something that potentially a speech therapist or maybe an occupational therapist, depending on whether there are additional sensory concerns related to that.
Thank you. Are there any more questions out there for the audience? No more questions. Well, thank you for tuning in with us today. Since we don't have any other questions, thank you, Dr. Pearson, and thank you, Elizabeth, for joining us today. This discussion will be available on our video section shortly after we're finished streaming. As always, feel free to leave us a comment if you have a question or concern, and someone from the Heart Center will get back to you. Mark your calendars for our next Facebook Live discussion on March 21st, where we'll be talking about the myths of sports restrictions, which is a good time to ask the question about the foods, too, for patients with congenital heart disease. Thanks again, and see you next time. Thank you, guys.
Thank you.